Yes, welcome to lecture 2. It's about the dose response curve. The dose response concept is an important concept in toxicology. We shall be discussing the dose response curve today. Then we shall discuss the various terms that define this curve. For example, we have the threshold, we have NOAEL, we have LOAEL, we have effective dose, toxic dose, lethal dose. This is Alteric, I'm a scientist. If we talk about the dose response curve, it's an important concept in toxicology. As we see, dose concept was termed by a man called Paracelsus, whereby he said that everything is toxic or everything is poisonous, but it's the dose that determines either something is poisonous or is not poisonous. Then we shall see, as we shall be discussing, we shall find various terms like threshold, effective dose, toxic dose, lethal dose, effective dose 50, effective dose 10, effective dose 90, toxic dose 90, toxic dose 50, and we shall talk about finally NOAEL and LOAEL just within this graph. So by the end of this lecture, we have discussed all these 4 graphs, and these are important graphs in toxicology. Like Paracelsus, the father of modern toxicology, he brought up that concept that everything is poisonous except the dose. For example, even though you take water, in 2007 there was an American woman who went for competition on a TV station drinking water without excreting, but after he had to die. So everything is toxic. Even these common drugs that we take, aspirin, ibuprofen, they all have dosage. Once you take an overdose, you have to die. For example, aspirin, if you take two tablets, it will be important. Even if you take more than 100, it will be now lethal. So all chemicals, all synthetic or natural ones, they have a capacity to be toxic. If you take a higher dose, then it will be toxic. And by that, you will have those effects caused by those drugs. So the dose determines whether a chemical will be beneficial or poisonous. By it being poisonous, meaning it will cause toxic effects or even lethal. That's meaning death. An example is about aspirin. Aspirin, it can be beneficial when you take 300 to 1000 milligrams. But when you take above 1000 to 30,000 milligrams, then it will be toxic. This is like if you take 2 tablets, it will play a beneficial role. And that's why we call it an effective dose. When you exceed 1000, it becomes now a toxic dose. And we always note effective dose as ED and toxic dose as TD. Vitamin A, this is just common ones. We commonly use these vitamins. When you take 5,000 units per day, it will play an effective role. It will play a therapeutic role or medicinal importance. But when you exceed 50,000 units per day, then it will be toxic. Even oxygen that we breathe in, we need it to be 20% in air. That one will play an effective role. But when you exceed 50 to 800% to 80% of oxygen in air, then it becomes toxic. So you can see that everything is toxic, but the dose matters, or the dose makes it either to be a toxic or to be beneficial. Within a population, different people will react differently. Because here, for example, this is our graph. We see that here this is the dosage, and the dosage is always in milligram per kg. Then this is the response. Response is always in percentage number of those individuals. For example, if maybe this population has been exposed to a certain chemical, you see that some people will be resistant, some will be affected by those side effects. Then others, majority will have an average effect. So we have to always understand that some people who are always resistant, they always take, if this is our normal distribution curve, they always take this left side. Then those ones, many who will be affected with average effects, will be in the middle. Then on our right side, a small portion also those ones who are resistant. So when people are making drugs, or when we are manufacturing drugs in clinical toxicology, we always consider the number of these people who will be sensitive, and we always try to minimize or reduce the number. So with the dose response curve, it's the dose that makes a substance to be poisonous, and we shall meet terms like effective concentration and threshold. If you're talking in terms of beneficial effective concentration, we shall consider like which concentration gave us an effective role, an effective or an important role. That's what we call as EC, the concentration that gave us therapeutic importance. We shall look at it how it comes to be. For example, we use experiment animals when we are determining this dosage. For example, we have rabbits, we have rats, we have guinea rats. What we do, for example, if we have our 4 experimental animals like here, we subject like each with a defined concentration, and then we want to determine which one will play an effective role, which one will be a toxic dose, and which one will be a lethal dose. For example, maybe if we inject in, we are having here our solution, but we're having our syringes here, they are like 4, and we inject each with a defined concentration. Maybe the first one we inject it with 0.1, second one we inject it with 0.2 concentration, then the third is 0.3, then the fourth 0.5. You shall see that maybe at 0.1 there is no any effect. Then maybe at 0.2 the animal began to respond to the dose. Maybe it was our effective dose, the treatment. Maybe at E3, at animal 3, which we injected with 0.3 concentration of that substance of our drug, so that the animal now began showing advanced effects, for example, like vomiting, maybe paralysis. So we can take it as our TD, our toxic dose, the dose where we can see advanced effects caused by the substance. Maybe in animal 4, where we had to increase the concentration, maybe we injected with 0.5, so maybe the animal dying. So we would say 0.5 would be our lethal dose of that particular substance. So we know that on animal 1, it had no response. Animal 2, which we injected with 0.2, whereby we had increased the concentration by 0.2, it showed a response, and it was a beneficial response where it played the therapeutic role. So that becomes our effective dose. Then, where we increased to 0.3 and animal showed toxic effects or advanced effects, then that one will be our toxic dose. Then the animal where we injected 0.5 and it showed lethal or death, then that one we take that concentration as the LOD, the lethal dose. And by that we will come up with a curve. And these curves, this is how they always be. Like this side will be the response, then here will be the dosage on the horizontal. So as you see, as we increase, maybe the concentrations would now move from being therapeutic, which is like our effective dose. When you increase the concentration again, maybe from 0.2 to 0.3, it played toxic effects. For example, the animal maybe got shown toxic adverse effects. So that will be our toxic dose. Then as you increase the dose, now we shall have the lethal dose, the dose when the animal died. By definitions, we define effective dose as a dose where a substance is beneficial. So that dose, remember, dose is the amount given, and dose is just amount of something given to an organism. So an effective dose is the dose where the substance played a beneficial role, and we always write effective dose as ED. Toxic dose is a dose at which the substance shown its advanced effects. For example, we always write it as TD. Then lethal dose is that dose of substance that causes death of living organisms. We always note it as LOD. This is how now we shall come up with curves. We shall always have here our response, then we shall have here our dose. For example, we shall have, this is like curve 1 about effective dose. See that maybe for this substance at 1, well, this is dosage, this is response. At 1, there's no response yet. At 2, that's when now we saw the response starting at 2. Then now we can say that maybe 2 was our effective dose. But based on this response, so we can, this response is in percentage. So we can say maybe at 20%, we would say maybe effective dose at 20% population. This is now this like percentage of population. So here we would say 40% population. So we always like using 50% population. So here we would say at 50%, what was the effective dose that played a therapeutic role in 50% of the population. So at 50%, that's what we take as ED. We now say it was 5. So the ED is saying 5 because we are saying that the effective dose at 50%, this is where the 50 comes from. So at 50%, we had 5. Then we have the lethal dose. Lethal dose are defined as the dose at which a substance causes or kills an organism. So if we say that we want to determine the LOD is the lethal dose. So what is the lethal dose of 50% population? So here we would say, oh, if this is 40-50, so this will be 50% of the population. Then when you plot it to a graph, it brings you like to 48. So now 48 would be our lethal dose at 50. That's what it means. Lethal dose, it means a dose where a substance kills an organism. So if we say LOD 50, we are determining now the lethal dose that kills 50% of the population. So we come here the 50% of the population, then we now plot, then we see. That's how we come up with LOD. And even have TD 50. So a threshold, we define a threshold as a point where adverse effects were first seen. That's where that point, we always call it a threshold. For example, this is a curve, is sigmoid. Here we have our dose and then the response. And we shall see that if this was substance A, at 0, there is no response. At 1, there's no response. At 5, no response. But as reached 10, this is now where we began seeing the adverse effects, because I see now the graph is starting at 10. So at 10 is where it now becomes our threshold. The point where now we begin seeing the adverse effects is the threshold. If we use this example up, you can see that now our threshold here it is 20, because for this substance we began seeing the adverse effects at 20. That would be our lethal dose. We can compare thresholds for 2 or more toxins. For example, like we have here toxicant A and toxicant B. You can see that this toxicant B, which is in purple, for its effects, the adverse effects are seen just immediately after 0. Because you can see that maybe after 0 here, as you increase the dosage for toxicant B, its effect began. Maybe this one could be like 1 at 1 milligram per kg, maybe because you say that dose is always in milligram per kg. So here we would see that at 1, the dose had the response for toxicant B was seen. But now toxicant A, which is in blue, for it to see that it delays to show the response until you increase the dosage further. For example, maybe at 0 there is no response. Unlike in A and A, at 0 we are already seeing threshold. Until maybe this is 5, that's now for toxicant A, that's now when we saw the threshold now increasing. So we can compare various threshold for various toxicants. An example is down. For example, like here you can see this is another graph that we are comparing to. We are comparing fentanyl and then we have morphine. Fentanyl is toxic, and you can see that for fentanyl, even at 0, when the dosage is 0, as you increase from 0 to 1, there's already response, meaning for the threshold is just immediately after 0. As you just start maybe at 0.1 before the response increases, meaning it's still highly toxic. Then you see morphine. Morphine, remember, this is obtained from opium, and it is one of the drugs that was discovered from plants. The first drug discovered in the 18th century, it's morphine. coming from opium. But remember, morphine can be beneficial or can be toxic. So as we increase morphine from 0, but once we reach 0.1 milligram, then now the advanced effects begin. That's why you see now John become its toxic dose. This is now when we see the advanced effect at 0.1. But before 0.1, morphine will be playing a therapeutic or medicinal role. So now we can determine here, because this is the response, and response is in percentage in terms of population or individual. So we can say this is 0, this is like 50% individuals. So now we can say what is the toxic dose at 50%. So you come here, this will be your 50, then now you plot and see. You can read that at 50% population, fentanyl will be 0.1. Maybe for morphine at 50% it will be 10 milligram per kg dosage. Then the other term that you always meet is NOAEL and LOAEL. NOAEL means no observable adverse effect level. Then LOAEL means lowest observable adverse effect level. Shall always meet them. Then we define NOAEL as the highest point at which there is no adverse effect. What is the highest point whereby there is no adverse effect? Question maybe if you take substance A, what is the highest point whereby if you take you can't die, or there's nothing like any adverse effect? Then the lowest observable adverse effect level, which we call as LOAEL, we define it as lowest point at which there is unobservable. It's the lowest point where there is unobservable adverse effect. On the graph, for example, here, this is our graph. You can see that for this substance, at 0 does no response, at 5 does no response until maybe 7. If this is 7 now, this way we are beginning, you see we shall begin it now being responding, maybe at 10. Because at 10 here, I'm seeing now there is a response at 10. So before 10, there's no observable advanced effect level. So now here at 10, we are seeing that it's now become the highest point where there is no advanced effect point. There's no advanced effect level. So that point, that highest point where there is no advanced effect level, that's what we call as NOAEL. Now 10 would be our NOAEL. Then we are seeing LOAEL, and we are saying that LOAEL is our lowest point whereby we see the advanced effects. For example, here we see that it's 10 where we see the lowest point where we see advanced effects now LOAEL, which is 10. Because LOAEL can't be up, it's always just down. We talked about the effective dose, toxic dose, lethal dose. Whereby we always write effective dose as ED, toxic dose as TD, then the lethal dose as LOD. So we can also determine it. We can determine the effective dose, toxic dose of a particular substance, and also the lethal dose. Then here we can determine it either at E10, effective dose at 10%, effective dose at 50%, effective dose at 90%, and effective dose at 100%. We can determine it just from our graph here, depending on the response of the people. Here it's the response of people or individuals, the population. If we say that what is the ED, we are meaning effective dose at 10% of the population. If we say ED 50, we are meaning what is the effective dose at 50% of the population. If we see TD 10, we are meaning the toxic dose at 10% of the population. If we say TD 50, we are meaning the toxic dose at 50% that can kill 50%, that can cause adverse effects in 50%. If we say TD 90, we are meaning the toxic dose that can cause adverse effects in 90% of the population. That's what we mean with this TD 50, TD 90, TD 10, TD 0. You can say even TD 0. Then you say what's the population that can have adverse effects maybe at 0. That's now to be TD 0. So we define LOD 50 as the dosage of a substance that can kill 50% of the animal in a population. Then TD 90 is the dosage of the substance that can cause effect in 50% population. We end up with such graph maybe for a particular substance, maybe at the ED, TD, and LOD. So you can determine ED, TD, and LOD at 50%. So you plot, then you have 50%. Now you come what is the ED at 50% for that graph. Then on the graph of toxic, you can come and determine the TD at 50. That's all. Thanks, that's the end of lecture 2. It was about the dose response concept. Mainly by the dose response curve, as we see that the dose makes a substance either toxic or non-toxic. And that's the concept that was developed by Paracelsus, the father of modern toxicology. Thanks, this is Black Altarik. You can subscribe always for more.